my laziness. Let's talk about it. Now, I wish I could say that I wore this fresh face because I'm strategic and a genius, because we're going to talk about my skincare routine. But really, I'm just lazy. And truthfully, if you were to meet me in the clinic, this is the Dr. KP that you would get. I love to dress, I love a good wardrobe, I love a good label, but I also like to minimize what I put on my skin as I'm spending a long day either in the OR or in the clinic. Some of you have asked, what is my skincare routine? I'm sure you don't want to hear my life story. I'm sure you don't care. But just to let you know, I don't think I was born with good skin. I think I earned good skin. When I think back to my high school days and even my college days, I remember a Chinwe before she became Dr. KP, who dealt a lot with what I thought was bad acne and bad hyperpigmentation. My skin, I don't remember ever being an even tone, and I struggled a lot with how to deal with this and spent a lot of money on gimmicky things that I thought would change the way my skin looked. As I've learned through working in plastic surgery, aesthetic medicine, I've personally been able to really change the way that I take care of my skin so that I can maintain an even skin tone, and as I'm aging, minimize things like wrinkles as well. But let's not give credit to my mama who gave me the good genes in the first place. Shout out to you, mama. But no, seriously. Okay. So, I have oily skin. Nota bene, for those of you who have oily skin, you are aging at a slower rate. Oily skin, because it keeps some moisture in your skin more readily than people who have dry or combination skin, people with oily skin tend to notice that they have wrinkles much later in life. So shout out to oily skin, my oily skin brethren. So I have oily skin, and what I used to think that meant was that if I dried out my skin, then that would be the key to minimizing acne, not dealing with hyperpigmentation, things like that. And so my skin would get really dry and crackly because I thought I was doing a really good job of drying it, and I was too good a job. And then I was getting more acne, more pigmentation, so really defeating the purpose. What I have since learned and what I know now is, one, South Korea has it on lock, and two, hydration is really the key. Hydrating the skin, both internally and externally, is going to be the key to making sure that whether you're dry, combination, or oily, that you are able to achieve better skin. So, my first step is an oil-based cleanser. I'm not going to reveal any products because, frankly, the products themselves don't actually matter. It's the principle of the step. So again, first, an oil-based cleanser. Now, what this does is it can remove makeup. It will remove the impurities that you've had from the night or from a long day. You rinse that off and follow that with a water-based cleanser. Again, it doesn't matter what the product is. It just needs to be a water-based cleanser. My next step is a toner, a hydrating toner. There are toners that actually have things like salicylic acid in them, and that can actually be a little too harsh for the skin at times. So I would try to stay away from those toners and focus on toners that say they are hydrating toners. Next, I use an essence, which again is just more hydration. I'm layering the hydration. My next step in the morning is a serum or an ampule. And this again is to layer the hydration. At night, my fifth step is actually retinol. So I use generic Differin gel, which is a retinol-based acne medication. I also mix that with a tincture of benzoyl peroxide. Again, because I've dealt with acne all my life, so I know that I'm never going to really be able to get away from dealing with acne. I thought that I would when I grew up, but it turns out age sometimes does not matter when it comes to acne. That's at night only. If you're going to use retinol in your program, I recommend starting really slow and low. So one, start with a little bit. Make sure that you're using it starting out every other night. And then if you feel like your face is irritated or burning, then take a break for a few days. Then again, I use a serum or ampule. So serum or ampule is day or night. The acne-based medications are only at night. After my serum or ampule, I follow it with a facial moisturizer. I use a lighter moisturizer at night, and a somewhat heavier one during the day. And then my last step during the day is sunscreen. So again, just run it down. Oil-based cleanser, water-based cleanser, toner, essence, serum, facial moisturizer, sunscreen. That's my daily morning AM routine. It sounds like a lot, but it takes maybe 3 or 4 minutes at most. I'm washing my face in the shower. The rest I quickly do, and then I get dressed. Again, I'm lazy. I don't want to create the time to put on makeup. So if I'm giving you a regimen that I do, it's probably pretty straightforward once you get started. At night, again, the routine slightly changes to oil-based cleanser, water-based cleanser, toner, essence, medication of some type, retinol, acne in my case, serum, moisturizer, bed. Now, the other thing that I do is that I also every other night use an eye cream. This eye cream does have retinol in it as well. Now, once a week, the routine gets a little bit longer. So once a week, I do oil-based cleanser, water-based cleanser, a chemical exfoliant. I've tried to use mechanical exfoliants in the past, but they've really been too abrasive and my skin feels like it's burning. And if your skin feels like it's burning even with the chemical exfoliant, then I would suggest don't do it, skip it for a while. Exfoliation is good, but only in small doses. It can really be harsh and abrasive to the skin, so you really want to minimize how much you're actually doing on a weekly basis. So I only do it once a week. Okay, so oil-based cleanser, water-based cleanser, exfoliant, in my case it's a chemical exfoliant, toner, essence, anti-acne, serum ampule, and then I do a face mask. I do a hydrating face mask. I leave that on, do other stuff. It can be on for about 10 to 15 minutes. And then I follow that up with kind of a thick sleeping mask, basically. It's a thicker cream, stays on the night. And then I definitely use my eye cream during this time. I also use a very kind of thicker lip serum as well. And that is my skincare routine. Again, the brands themselves don't matter. And what I found is the expensive brands don't necessarily give you more than the cheaper brands do. I would give you my hookup, but they don't pay me. And so when I say South Korea has it on lock, know that I use mostly South Korean products, and you can just Google that and hopefully find something that works for you. Don't spend a lot of money on this. It doesn't require a lot of money, and just focus on hydration. Now, some may say that the layering may actually clog the pores. In my case, I haven't found that. And so this is not a prescription for you, obviously. But this is, again, what I have done and what's worked really well for me. And this has helped me to be lazy while also not feeling self-conscious about how I look and how my skin looks when I go to work or when I move about the world. But what do you do? As always, leave your comments below. And as always, love you lots and bye for now.